Yesterday, we learned two most important things about the implementation science or implementation research. Let's try and understand the designs which would be used by all of us to go forward with any new implementation research, if at all we want to go in near future. Let's look at the research questions. This is something I begin because the basis of the implementation research is always a question. Research question is the starting point to any inquiry for that matter, and not necessarily the implementation research. Implementation research can overlap with other types of research. And the distinctions between other research and implementation research are not always very clear. But that doesn't mean that you do not focus the research. While framing any research question, this is something we have to keep in mind, that there is likelihood of overlap, and we have to focus that we identify research questions that address the implementation science research itself. A range of implementation research exists based on the implementation research question itself. Now, there are some very important research questions that revolve around the objectives. Let's look at the 7 most important. There may be others, but these are the 7 most objectives. If your objective is to explore into the implementation research that you want to do, in that case, how should your research question should be? It should be, what are the possible factors and agents responsible for good implementation of a health intervention, for enhancing or expanding a health intervention. But if you want to describe, then your question should be addressing what describes the context in which implementation occurs. What describes factors influencing implementation in a given context? That is how you look at a research question when you are trying to frame a research question to describe implementation research. When it comes to influence with adequacy, then is coverage of a health intervention changing among the beneficiaries? This is how your research question should be framed. When it is to influence, if your objective is to influence with plausibility, using the implementation research, then is a health outcome plausibly due to the implemented intervention rather than the causes around it? So that is how you look at when there is something around plausibility of intervention you are looking for. But if you want to understand the influence with probability, then the question changes, trying to understand the health outcome. If you just want to explain the implementation research, then your research question should address how and why does implementation of the intervention lead to effects on health behavior, services, status in the all its variation, etc. And there is implementation research for which the objective is to predict, in that case, what is likely course of future implementation. That is how your research question should look like. Let me go to the next one. Just give me a second. Okay, let's look at the study designs now. Research question, I think most of us understand, but when it comes to implementation research question, these are the some things which we have to keep in mind. But let's try and understand about the designs. There is going to be, you're going to feel that there is a little bit of repetition in what yesterday we learned from Dr. Rajiv and Dr. Jose, and what I'm going to say. But this is not really a repetition. It is primarily to just get back to or do some revisions before we go into the research design, because what we learned yesterday is extremely important, and designing your research also, these things are very important. Let's look at the terminologies. Dr. Rajiv explained us how terminologies are interchangeably used. And you can see all these terminologies for implementation research used. But is there any difference between the two? Probably yes, or probably not. Why do I say yes? Because if you go to a dictionary, or if you go to the academicians who are into training the research methods courses, they would tease out every bit of it, whether you call it the word operations or health policy or application or implementation. So every word will give different meaning to some extent. And that is how it could be argued that these are different. Nevertheless, we need to keep in mind that in general, by those who use implementation research, more so the implementers who have to use this, these terms are interchangeably often used. Let's go to the next important part of it. We have learned this from Dr. Jose, especially the top right-hand corner. What happens before the implementation research is important. We can't forget that. How the intervention has come into existence. It started with, before designing the intervention, there is a lot of research that goes into, for example, if it is a drug, if it is a vaccine, you do a lot of efficacy studies. You primarily start with identifying what is the solution. You start identifying the drug or the vaccine, then you study it, look at its efficacy, see if it is really useful, to what extent it is useful. Is it useful when it is implemented at large scales in the community setup? So those things you do effectiveness studies, etc. And then you go into the implementation research mode. And in the implementation research, we explore initially to find out what is the research question to be addressed is the beginning here. And then you go into the 4 phases, which Dr. Jose very nicely explained. I don't want to repeat, but there are these 4 sentences. We must go back to yesterday's presentation, and that is what is exploration phase. That's the phase 1. What does it talk about? It helps us to identify and expand the user base of health strategy of the program or a program. In the adoption phase, you identify factors related to the formal decision to implement a strategy or a program. And in the implementation phase, you actually intervene with that intervention, which is important for you as assessed from your pre-intervention studies. And then once you have implemented it, you have to sustain it. But how do you do that? What happens in the sustainment phase? What happens in the exploration phase? This is what we have to understand using this 6 steps of the implementation research cycle. Yesterday, very briefly, Dr. Rajiv Bell mentioned that it's a cyclical process. What does it mean when we say it is a cyclical process? Now let's begin with, because we started the day today with research question. How does the research question come into being? How do we understand these? And for that, and it's not only in the field of health or implementation research or for any field for that matter, when it is trying to understand or get to research questions, is the contextualization of the challenge that you face. For us, it is in the field of health research. Now, if you contextualize the challenge, you would come out with a number of research questions. All of you, please keep this frame or these 6 steps in mind, because this is what is going to help your discussions tomorrow when you are going to work in groups. There are quite a few slides today which would really be of help to you when you go into the groups tomorrow in different rooms. Once you have contextualized, you have understood the research question, then you need to find answers. How do you find answers? Do you develop a proposal in which what do you write? As you do it for any other research, find out the methods you would use. How would you use those methods? Design properly. And once you have your research proposal ready, then you go into the planning and implementing. So you plan properly, implement it then. Once you have implemented the intervention which you have planned using the research questions, then comes you have the data ready. Once you have implemented, so analyze the data and present it. Once you have presented the data, what is important is, now please, all of you or many of you are researchers. Easiest thing is, analyze and present. Once one feels that present is presenting to the larger audience with your presentations or with publications. That is not what we are intending when we say dissemination of findings and feedback. Usually dissemination is understood to be by the scientists as, oh, we have disseminated very nicely by writing 10 papers of research. Is that dissemination? No. Here it means you disseminate in the form of introducing the change. The analyzed data gives you possible changes that are necessary into the intervention which you are doing. And that is what is dissemination here. You implement it by disseminating it to the study teams. Give them the feedback, what you have understood in the intervention research you conducted so far, and what needs to be done so as to improve the intervention. So that's what you do. But if you change the program in between, after understanding it more, once it has started, you need to monitor it well. And once you monitor it, you also remember that you have to evaluate it. Has the change really happened the way you expected? Has it made any difference than what it started? So that is what monitoring and evaluation happens. But once you monitor and evaluate, you will realize that, oh, we did make changes, but this particular change probably needs more change. Why? Because you might come across little more challenges. If there are more challenges, again, contextualize the challenge to get into the new research questions. And that is why you have to, again, go back to the same cycle. And this tells you how the 6 steps of implementation research cycle are continuously happening one after the other. And then let's go to the next, the approach to the implementation research study design. We today are going to discuss about the study designs. There are plenty of study designs, and it'll be very interesting for you to understand how study designs are to be decided. But for that, we need to understand implementation research study designs all need to relate to speed, quality, and level of access. Why I say speed? Because we know if it is an implementation, say for instance, implementation of a program which is designed for, say, TB implementation. Tuberculosis program has been in this country for years together, decades together. And then you have a little bit of change in that. Is the speed mattering? No, may not be, because you know the program is in place, the disease is in place, we have systems in place. We need to make changes in the program at its own pace required. But when it comes to, say, a pandemic like today, what we are all facing, the COVID pandemic, if there is an intervention or that comes up, maybe for behavior change of the population or for maybe vaccine introduction, then the pace at which it should run should be extremely fast, because we should run ahead of the disease spread or the speed of the disease spread. And that's why it matters more. Quality and, of course, level of access does matter. Now, different approaches to the IR study designs compared to conventional research is again something which we need to keep in mind when you approach with a specific study design. Can we combine different methods in a single study? Yes, you can. Often you might have heard or read or written or done using terminology like mixed method. Now, this is not really mixed methods approach. It's actually trying to implement or an intervention with specific different methods. So don't confuse yourself with the mixed methods approach, but this is about the designs. Implementation process is inherently multi-level, from individuals to policy. That we are going to learn, we have understood yesterday also, it is multi-level, because without this implementation research or implementation itself will not work. The multiple stakeholders are involved at all levels of implementation research. So that needs to be kept in mind. And implementation research provides opportunity for hand-holding of implementers to roll out a new adapted strategy or a program. Now remember this hand-holding, you're not teaching them, you're not preaching them, you're not, what you're doing, you're working with the health system. You know they have their expertise, tremendous expertise, which the researchers do not have. What the researcher could do better is, whatever the researcher has understood, we could take it to the implementers to be effectively implementing the programs which they are already implementing. And for that, again, I'm coming to the approach to IR study designs. In this, as I started with the first slide, ultimately the research questions determines the IR study design. If that is so, let's look at these two boxes. The right-hand side box for you is very important. The left-hand side box is the examples of questions in a pre-intervention research, which we said it's about efficacy or effectiveness, etc. Is a new treatment better than the current guidelines, etc.? So that's something which you want to do if you are designing an implementation research before the implementation research. When it comes to implementation research questions, you need to really understand, does intervention work in the health system? What adaptations are required once it is introduced? And that's why make the intervention more cyclical in nature. What are the challenges and barriers to introduction of new guidelines, which are already there? The program is implementing those guidelines. But in the process, do we need to make changes in that to suit to the or to adapt to your situations in your state or in your country? In that context, it is important that what are the changes needed? That is what we need to understand. How can we improve the quality, efficiency, and equity or equitable distribution of policies and the programs? For this, we think that IR is the most suited method. So implementation research could be very well done in this case, and that's how the research question should be looking at. And now I'm going to hand it over to Sudipto to take us through the different study designs that we have to keep in mind when we go tomorrow into the next level of doing the development of the proposal itself or the research question itself. Thank you very much.
Thank you, Dr. Sanjay. Okay, so now over the next 15 minutes or so, 10 to 15 minutes, we'll have an overview of some of the common study designs which are used in, which have been used in implementation research. Now, I'd like to just kind of warn in the beginning that I may go a little fast, and not every term may be, I will be able to probably have time to explain. So please, if you have any questions about any of these methods, any terminologies, please put them in the question answer box and we'll try to address them at the end of this presentation. Right, so one of the commonest methods used even in implementation research are intervention trials. All right, so these are very similar to clinical trials, right? So we have controlled trials, randomized controlled trials. It may be individually randomized or cluster randomized. We have non-randomized or quasi-randomized controlled trials. A little bit about more on quasi-randomized I'll talk in the subsequent slides. We have controlled before and after trials. You know, we follow the same group of participants before and after an intervention and then compare at different time points. And very commonly used in implementation research are time series trials. Time series trials basically compare results over time to distinguish secular trends from intervention-related trials. Now, within time series trials, one of the commonest design which has been used are interrupted time series studies. So interrupted time series studies are nothing but time series studies in which the intervention is an interruption. And then we compare what happened pre-intervention and what happened after the intervention. It is usually known as conducted as a quasi-randomized trial because the intervention might happen through a government program in which the researchers do not intervene, but they take advantage of an intervention that has been introduced by the government or is going to be introduced by a government as a program, and then they measure before and after. Interrupted time, and then there are special analytical methods for interrupted time series. I won't get into that because Dr. Kazi has a whole presentation on that. But I'm just trying to focus a bit more on interrupted time series because that's been used very commonly. always when we are trying to conduct or design such trials, especially in implementation research, we look at different levels. Now, in clinical trials, we focus, they are mostly either individual randomized or cluster randomized, for example, and we do not think too much about context or the larger environment. This is the difference between a typical clinical trial and a trial in implementation research, in which we need to consider these 4 levels that we can see: the individual, the larger group, the level of organization, and the overall environment. And then, based on certain assumptions for each of these levels, we have to design the trials. For example, at the individual level, we have to look at individual characteristics such as knowledge, skill, or expertise, or characteristics of an individual. For a group, we need to look at group dynamics, coordination, share knowledge sharing between the groups, and then design a trial accordingly. At the level of an organization, say a medical college or a government or non-governmental organization, the structure and the rules of the organization play a major role in determining some of the specific design inputs for an implementation research study. And then, of course, the larger environment in which the study has been conducted. Either we look at policies, we look at regulatory approvals, regulatory environment, etc. So the point of showing or talking about this is to just make a difference between an intervention trial, a trial in a clinical setting, and trial in an implementation research setting. So these factors have to be kept in mind. Then what are the common issues or special issues, I'd like to say, with intervention trials in implementation research? Frequently, inadequate or inappropriate performance at any one of these levels that we just saw, any one of the 4 levels, can affect the results of even a well-designed IR trial, right? I mean, we can all, I think, imagine if you're talking about context, if you're talking about organizational level characteristics, then even a small change in that can affect the outcomes, or the measurement of the outcomes. Another obvious issue that many of you would have probably realized is that when you talk about multi-level randomization, if you're looking at all these 4 levels, or even if you're looking at 2 or 3 levels, and you'd like to randomize according at each of these levels, I mean, those of you who have worked in trials would know how complex even a single level randomization is. So now imagine multi-level randomization is such a complex process, and ultimately it may affect the power of the study to detect a change that we are aiming for. The challenge is to use valid and reliable measures of outcome for each of these levels is something that needs to be thought out very carefully. I mean, outcomes in clinical trials are pretty much, I wouldn't say pretty much, but we know there are a fixed set of outcomes that we usually look at. In implementation trial and research, we need to think about those very carefully. In spite of this, whenever we are doing a trial, even if we are considering the context of environment, etc., it is still difficult to mimic real-world conditions, right? Even if we just focus on an intervention trial in implementation research, right? So these are some of the issues that we need to think if we are designing and implement an intervention trial in implementation research. So what are some of the adaptations for in implementation trials? So one is something that we were talked about yesterday also. Dr. Rajiv and Dr. Ranadeep also spoke about this of pragmatic trials. So what basically, pragmatic is a huge area in itself. So just briefly to touch upon pragmatic trials. Pragmatic trials focus on effects of the interventions in routine practice as much as possible, right? These trials seek to maximize variability in the way the intervention is implemented, right? So variations in pragmatic trials are accounted for right in the design phase of the trial. It helps to maximize the generalizability of results to other settings because it's pragmatic, because some variations are taken into consideration, so their scale up or generalizability improves as compared to a regular clinical trial. Pragmatic trials include an extensive formative period involving implementers and policymakers to design the intervention strategy. I think this is common for implementation research in general, as we have been seeing since yesterday, that stakeholders have to be involved right from the design state. However, the methodology must account for changes during the trial period. So there is recently, over the last decade or so, adaptive trials have also come up, which is a form of pragmatic trials, right? So adaptive trials, it doesn't mean that you change your processes as you go along. Adaptive trials, pragmatic trials are still structured. The changes have to be predetermined based on certain triggers or thresholds. You cannot just change as we go on, right? So these are some adaptations which have been used in implementation research. Cluster randomized trial, just a brief example of a cluster randomized trial. This was in the US, a SPARK trial. It was a pragmatic cluster randomized stepped wedged implementation trial to evaluate whether an implementation intervention package increased alcohol screening and brief alcohol counseling and diagnosis and treatment of alcohol use disorders in 22 primary care clinics in Washington. So the sites were randomized, the clusters were randomized to implement the program on different dates, and the primary outcomes were patients who screened positive for unhealthy alcohol use and then have a newly recognized alcohol use disease and subsequently initiate and engage in alcohol-related care. And the point important for implementation research was to assess barriers and facilitators to implementation and required adaptations, right? So this is an example of a cluster randomized trial used in implementation research. Another example was a pragmatic trial to demonstrate that healthcare workers other than doctors are capable of meeting the demand for care of HIV-infected individuals in South Africa. So again, the clusters were randomized. In this case, a primary care clinic was a cluster. They were randomly assigned to either nurse-run program or usual standard program. And then mortality rates, and it was found that mortality rates, viral suppression rates, and other measures of quality did not differ or actually were higher in the nurse-run program. And step-wedge design is another adaptation of trials in intervention research, which was also touched upon yesterday by Dr. Rajiv in his talk. So in step-wedge design, basically it involves a sequential rollout of intervention to different units over time. So time is a factor in this. And by the end of the study, everyone has received the intervention. The randomizing the order of rollout, it enhances the rigor of the study. Data collected and outcomes measured each time a new group receives intervention, and the pre-receive, before the group receives the intervention, that period serves as the control. One good point, one statistical important point is the power is relatively well preserved in a step-wedge design. So hence, even Dr. Rajiv said that step-wedge designs are now increasingly being used along as a pragmatic trial in implementation research. We now look at the next type of design, which is again now increasingly being used in implementation research, effectiveness implementation hybrid trials, right? So both effectiveness study as well as the implementation research are combined in these trials. They can be of three different types. The first type, it tests the effects of an health intervention on outcomes. At the same time, observe and gather information related to implementation challenges or barriers and facilitators. The second type is dual testing of health interventions and implementation strategies. So you not only test the efficacy or the effectiveness, you also look at delivery models for that intervention in the larger community. And the third type is a strategy in which only the implementation strategy is being tested while observing and gathering information on the health intervention's impact on relevant outcomes, right? So in short, it basically means you're doing an effectiveness trial, not trial, I would say, an effectiveness study, as well as you're looking at implementation challenges, barriers, facilitators, delivery systems at the same time. You do not need to wait for an effectiveness result to come out and then do it, and then do the implementation part. So that's why it's obvious that this speeds up the process of research to delivery because you're doing both together. Very importantly, it allows the identification of important intervention implementation interactions, which usually are found in isolation. Here is a chance to consider them together. It is less resource intensive because you're doing it in one go, and it also allows the design of adaptive trials. One big example of an effectiveness hybrid trial in India is the D13 study, which is being conducted by CMC Vellore, in which it has two components. The first component is a cluster randomized trial, in which the two arms are a community-wide mass drug administration, and the second arm is a routine mass drug administration for children. At the same time, implementation research is being carried out in which we are identifying stakeholders, conducting qualitative research of these stakeholders, looking at the readiness of the system, health system to roll out this intervention once it is proved and processes involved, right? So I'm sure once the study is completed, we'll have a look at the publication of this study. There are some more hybrid trial examples. I don't want to spend too much time on this, but this was a testing of a newborn care package in Sylhet, in which the effectiveness of this care package was measured in terms of hard clinical outcomes, mortality, morbidity, as well as the ability of the health system to deliver this package was also tested through an implementation research framework. We now go on to the next method, mixed methods designs. Dr. Sanjay also briefly mentioned, so mixed method designs basically collect, analyze, and merge both quantitative and qualitative data into one or more studies. The qualitative part or the component of a mixed method will explore and obtain depth of understanding. So it tries to answer the question why from a stakeholder perspective. And whereas the quantitative methods will test the hypothesis and obtain the breadth of the knowledge, right? The hard outcomes. Both methods may be used in parallel or sequentially, and both methods can be given equal weightage to evaluate implementation fidelity and barriers. It depends on what question the researchers are interested in. These are some of the common mixed method designs. Now, I obviously, we won't go into details of this because it's a brief overview. This is just to showcase the width of the breadth of mixed method designs that we have. It can be a convergence design, it can be complementary, it can be a expansion of quantitative into qualitative or qualitative into quantitative. It can be a developmental method, and qualitative methods which give rise to quantitative research questions. Typically, mixed methods, there are different ways to integrate data collected from qualitative as well as quantitative methods. You can merge data, you can connect the data, you can embed it. These are, again, scientific terms. I won't go into details, but please ask questions. Please post your questions into the question box, and we will address them as we go on at the end of the session. We have an example of a mixed method study conducted in India on evaluating the performance of a multi-strategy national health program to reduce maternal health childhood disparities. The quantitative methods included the degree of implementation including the financial part or the budget utilization rates, and compared health outcomes, demographic outcomes, pre and post NRHM implementation period. The qualitative methods included assessing the perceptions and belief of stakeholders, using in-depth interviews and focus group discussions. The next type of study which has been used in IR is a quality improvement design. I think many of us would be familiar with this PDSA cycle, or the Plan, Do, Study, Act, which is very similar to what Dr. Sanjay also mentioned at the beginning, the 6-step cycle. So this is a shorter version of that, of the same cycle. But this PDSA cycle is commonly used in systems, and within health systems, many of you would have probably been part of an evaluation of quality also, improvement also, in which this PDSA cycle is used. So you plan for an improvement, you implement the improvement, you measure the changes, the intervention or improvement brought, and then you act according, you feedback the data from the measurements back into the program. It is a cyclical process. One example would be a cervical cancer screening, which was conducted in El Salvador. The issues were inadequate uptake for cervical screening by eligible women. There was unsatisfactory lab testing quality, which was documented. PDSA wasn't implemented. Outreach workers were trained, lab quality trainings were done, including this personnel and equipment. And after just 1 year, results improved dramatically with an increased uptake as well as satisfactory quality lab testing. And then this process was then picked up by the Ministry of Health in El Salvador to expand the program. Another common method, design and implementation research, is in participatory action research. As the name suggests, it assigns power and control over the research process to the study participants themselves, right? Stakeholders. I mean, in this, the stakeholders are the end users themselves. Typically involve an iterative process of reflection and action carried out with and by local people rather than on them. And so it's basically a bottoms-up approach, right? So we talked about this yesterday also, the iterative process and involving stakeholders. And then this is just a box of research attributes, but usually researchers are encouraged to pick up based on the research question they're finding, pick up the question that they're looking at, and then accordingly look at the characteristic that they want to describe in their study design. The DOTS program in India is a very good example of a participatory action research design. If most of you would know that till 1992, it was only a national TB program, and from 92 onwards, the RNTCP, the Revised National TB Control, and the DOTS program came into play. This was based on the experience of the pre-1992 NTP, and based on patients of tuberculosis, feedback from patients of tuberculosis, the RNTCP and the DOTS program was devised. A bit quickly, I'll just like to touch upon a realist review. A realist review is nothing but a systematic review. It's a modified systematic review of complex policy interventions, right? So it's more of a desk job. A realist review is more of a desk job in which you go ahead with a systematic review of available literature, but the literature that is searched includes policy interventions and programs, right? So one example, just to give an example, there's a WHO background paper on availability of qualified health workers in remote and rural areas, which show the scarcity of evidence as well as limitations of currently available evidence. A realist review was done, in which an analytical framework that describes how an intervention, that is retention strategies for workers in rural and remote areas can be formed and how it can result in certain outcomes. This review gave newer insights into the issue and possible solutions and helped the WHO to come up with modified programs, modified guidelines for care in remote and rural areas. And then just the final one I would like to say is the design which has been used is a system science approaches, which is basically a transdisciplinary approach to understanding how interactions between elementary units produce complex patterns, which is a crucial component of IR. We have seen how IR works at different levels of different levels of the population, community, etc. System science approach directly deals with interactions across different levels and stakeholders. Okay, these are some of the terminologies. I will not like go into details, but the presentations are there. It will be shared with you, and you can of course read about a bit more about them. Finally, I'd like to just mention demonstration studies. I won't go into detail because there is a whole presentation on how a demonstration study is conducted in the through the possible serious bacterial infection study, which is conducted in India at 2 different sites, and the rotavirus vaccine rollout, which all 3 institutions, SAS, CMC, and KEM took part. So so we'll talk about this in little more details when we talk about the PSBI study after some time, right? So to end with, as you can see, we have a basket of methodologies for implementation research. However, choice of design is not random. As Dr. Sanjay also mentioned, it depends on the implementation research question that is being asked, and logic guides the IR design and process, and methods flow from the research question. Okay, thank you. I know this was a bit heavy and terminology heavy presentation, but this was just to give you a brief overview of introduction to different study designs used in implementation research. So if we have any questions, how are we doing on the time? Okay, we have a minute for some questions, but we'll keep a note of all questions that are there in the box, and we'll address them at the end of just before the break or during the break, if we can address those questions. So are we done with the time?
Yeah, we have 2 minutes.
We have 2 minutes, so let's see if you have any questions. Okay, so there is a question. Do we have an independent body like a DSMB to look into IR trials? Well, as of now, at least in India, we still have the same regulatory approvals and the same regulatory and ethical committees, ethics committees, regulatory approvals that also consider implementation research trials. There isn't any special DSMB. However, members of the scientific advisory committees can look into these implementation research trials.
Cherry, hi Cherry. Hello Cherry, this is Sanjay here. Cherry, you have been into this for quite long.
Right.
Can you help Sudeep to answer this? Yes, I know there is no DSMB per se in this, but with your experience.
Usually when you do implementation research type of studies, you're doing them from a perspective of wanting to have the data shared as widely as possible and influence policy. So in many of the studies that we've done, we've had people from the government overseeing the work, or the funders put together an expert group that is external to all the investigators that oversee the work. But I think there's Jose and Nita are here as well and have way more experience than I do.
Thank you, ma'am. Dr. Nita, Dr. Jose, would you like to add to this?
Jose, you can, based on all the studies that have been coordinated by WHO. Please go ahead. We can't hear him. Is he?
Sorry, let me.
Yeah.
Is it better now?
Yes, Jose.
Yes, Dr. Jose.
Okay. Yeah, DSMBs are clearly necessary when you have a concern about the safety of your intervention. And at a second level, if you have concerns about the adequacy of the design or the implementation of the study, and that you want to follow the study up, so that someone is not blinded to what is happening with the data coming in, and can advise the sponsor about changes that are needed. So usually you only move to implementation research stage when you have a lot of evidence to indicate that, well, this is a safe intervention, it's an efficacious intervention at least, and you want to learn how you can better implement that intervention in order to achieve better coverage, more efficiency. So it is rare that we would get into a situation for implementation research studies that usually tend not to be trials, will require a DSMB.
I'd just like to add to what Jose said. So let's say, Sudipto, you had mentioned Rotavac rollout.
Right.
So studies like that, let's say where a vaccine is being rolled out and you want additional safety data, in such studies, then those studies will have oversight of the regulatory bodies, not necessarily a DSMB, but the authority that looks at the safety data. Over.
Okay, thank you, ma'am. Thank you, Dr. Joseph. We have a couple of questions, but I think we'll take it at the end of today's session or during the break, or we'll try to answer it in the chat box itself.